views and opinions of the following show do not necessarily reflect the views and opinions of News Talk 1450 WOL, Radio 1 Incorporated, or their management.
This is Montgomery Mosaic on 1450 WOL, WPRS HD2, and worldwide on WOLDCnews.com. Montgomery Mosaic features topics of interest to Montgomery County residents, businesses, and visitors. Here now are your hosts, Deborah Milo and Ron Thompson.
Good morning and welcome to Montgomery Mosaic. It's great to be with you today. I'm your host, Deborah Milo. Today, I'm fortunate to have with us a guest from the African American Health Program with Montgomery County Department of Health and Human Services. And her name is Heather Ross, and I wanted to talk a little bit about Heather. This is actually her first year to be with the county, so we're celebrating an anniversary for her. Good morning, Heather, and welcome to Montgomery Mosaic.
Good morning, Deborah. Thank you for having me.
You're more than welcome. It's great to have you here. I wanted you to share a little bit about your own personal history and how you journeyed to become the program manager for the African American Health Program. Can you talk a little bit about that?
Sure. I actually started with my degree in community health science through the University of Maryland, College Park. And it's funny because I started off as a microbiology major. I actually took a class as an extra class on health disparities in the Black community and loved it. And it just started from there. I actually moved from different locations. I've worked in Howard County. I've worked in Baltimore City. I've even done projects in the Eastern Shore, Western Maryland. But then the opportunity to come here in Montgomery County came, and I love it. And I really appreciate the experience I've had and working with all the individuals, not only in the county, but also with the state and other agencies as well.
Well, you really have come a long way. You've got so much experience and knowledge behind you, so I really want to talk a lot about the actual African American Health Program. Can you share with us what exactly the program consists of, and what does it mean to the Black community as a whole?
Wow, that's a lot. The program actually started from an issue that happened in the community. Department of Health and Department of Health and Human Services in Montgomery County saw an issue of infant mortality in the Black community, really trying to figure out what's going on. More Black babies were dying who were living in this county, and the department, a few individuals in the department built a Healthy Baby Symposium. We actually had Dr. David Satcher, who came and spoke about the issue of health disparities. And from there, the Montgomery County Department of Health and Human Services brought in, together with them, convened a community group to talk about these issues and focus on health disparities. And out of it came 4 community coalitions that were formed to address these disparities, looking at infant mortality, diabetes, HIV and AIDS, and oral health. And the core group of HHS employees, as well as the community members, came to basically develop program goals, strategies, and objectives to basically figure out how to address these health disparities. And that is where the African American Health Program began. And it's been that way since 1999. We have focused on not only infant mortality, HIV, diabetes, oral health, but we also target cardiovascular disease, cancer. We do that through outreach, health education, support groups, nurse case management services, and we work with the community. That is our big focus. We cannot do this alone. So that's one of our strategies that we really do within this program. And because we work with the community, we really focus, and we have a very robust and we have a very active executive committee, which are members of the community, organizations in the community who want to work and fight towards these issues as well.
You mentioned that the program has been in existence since 1999. Do you feel that strides have actually been made in order to reach out to the communities during that time?
Yeah, we have, not only in Montgomery County, but in the United States, there have been strides. We've seen a reduction in infant mortality. We've seen a reduction in diabetes incidence, meaning individuals who are diagnosed with diabetes. But we still have a while to go, because within infant mortality, especially here in Montgomery County, we are still at a higher level. We have individuals, our babies who, and when I say black babies, this includes individuals African American, African Caribbean, individuals of African descent. These are babies who we are finding are dying before the age of 1, are still dying 2 times more than white babies. We are finding that we still have this issue. When we talk about diabetes, we still have a higher incidence of diabetes. We have about 7.8% of individuals who are diagnosed with diabetes compared to 4.9 of non-Hispanic white individuals. So we still are having issues out there. And we also look into as well obesity. Obesity trends are increasing, especially among our children. So we within the African American Health Program see these concerns and issues, and we're really trying to continue to do what we do, as well as build upon what we've done, but make some changes based off of what's going on in society.
You know, that's so much. The way that we, our communities, how the diseases impact our communities is just monumental.
Yeah.
And sometimes I don't think, pardon me, that people in the community really understand that impact. Can you talk a little bit about some of the challenges and or the barriers that are when it comes to reaching the communities? Because you and I have had a chance to share some great communication before when we've talked about some of the experiences that we've had when it comes to outreach. And I know that this is a big one because there are some challenges, especially here within Montgomery County, because no one wants to talk about the challenges with reaching the African American or the African community. So can you share a little bit about that?
Yeah. Our challenges are more or less, we have a lot of great people who are behind us, but we need to be able to bring people out in the community. We can do such wonderful events, but if they don't come, then we're not able to help them. And we are actually very fortunate to have some great events that have been coming up and that we're doing and that have actually been built upon for the many years that we've been in existence, and it's just getting the word out. One of the issues, let's look at infant mortality. Infant mortality in Montgomery County is a totally different picture. Infant mortality in Montgomery County really is targeting the woman who is 40 plus, who is, we'll say, middle class, upper or even upper class woman who has a job, has health insurance, goes to the doctor, yet she still is dealing with having that high infant mortality. She's actually in the process of losing her baby before age 1 or having a low birth weight baby. And that's different than what people think about with infant mortality.
Right.
So we, within the African American Health Program, have been able to try to change that perception. And instead of saying we're waiting for people to refer and come to our program, we have actually started a great collaboration, and it's taken a long time. It started before I came, and it's just recently come into fruition, where we're working with one of the largest OBGYN providers in the county to then bring the message of it's your woman that we need to really look at and to help. How can we help you? And we have a lot of services that can help you in that sense. And that was just the stepping stone, because again, it's not just looking at that woman who is low income. It's not just looking at the woman who may be teenagers. Some people have this perception of infant mortality, but it's not. It's this woman who has the health care, has the resources, yet she's still having low birth weight babies, and she's still losing her baby before age 1. And there's issues like stress. And think about it. These are the women just like you and me.
Right.
And actually, if honestly, I am one of those women. I actually had my daughter. I was working. I had insurance. I was young. I was in my mid-20s, and my daughter came at 32 weeks. And she was born 4 pounds, 5 1/4 ounces, and my doctors looked at me saying, we don't know what happened. We don't know where this came from. But again, I was a mom, I was a wife, I was working, I was dealing with the home, the bills, everything. Right. And stress like that, we don't think about as being an issue, but it is. And we need to start thinking about that. It's not just about getting health care, but it's also those other pieces that go into it. And to this day, right now, my daughter is 19 in college.
That's what she said.
Yes. And doing wonderfully. But it's somehow we have to change that. So we're doing little things like that to get the word out, and the community has been very supportive of that. When we deal with working with the African community, we've actually had a great response with our Diabetes Dining Club, which is we call it the African Diabetes Dining Club.
Okay.
It started off as just a dining club that we did, which was it was like almost a support group. It allowed people to come together, learn how to eat healthy, but also talk about issues that they may be dealing with diabetes. And what we were finding, though, was many individuals who were coming from the community to these events, they said, okay, this is nice, but I don't eat these foods. You know, I
Right.
like my indigenous foods that come from my country.
Traditional foods.
Yeah.
Right.
I love it. I want to eat this, but how do I cook it in a healthy way that my husband, he's diabetic, so he won't eat this, but he'll eat this. How can I fix that for him?
Okay.
And we then decided, well, let's work with some caterers who work with that traditional African food. Let's work with some dietitians and nutritionists who are from the African community. And we built an African Dining Club, and that has been going on for almost 2 to 3 years, and it's been very successful.
If you've just tuned in, welcome to Montgomery Mosaic, and I'm chatting with Heather Ross, Program Manager of the African American Health Program with Montgomery County's Department of Health and Human Services, and we're currently talking about some of the barriers that have been there when it comes to reaching the communities. And Heather was just talking about a wonderful program, the African Diabetes Dining Club.
Yes.
That sounds okay. That sounds like something I really want to join. I'm fortunate to say I'm not a diabetic. However, it sounds wonderful. So can you talk a little bit more about some of the other services that are available through the program?
Oh, great. Yes. We, as I was saying about infant mortality, we have a wonderful SMILE program, which is our nurse case management program. And with that, we also offer childbirth education classes, and we actually have a class coming up on March 8th, 15th, and 22nd. With that, the women learn how to breastfeed. They learn working with the nurses one-on-one. It's a great program. I love them. Those nurses do a lot of work. We do our, as you said, our Diabetes Dining Club with our diabetes self-management programs. We do one-on-one diabetes counseling with our clients who are involved in our AHP programs. We have HIV counseling, testing, and referrals to programs, and we do HIV education, health education, and STI education. We actually have a wonderful program we just started called Power Play, which is working with youth and trying to get them exercise and active and healthy eating, and that's just started. We also have a wonderful piece of our program is working with our community health workers as well. So that's and they do education, but they also do blood pressure screenings and referrals for anyone in the community.
That sounds wonderful. A little bit about February being Heart Health Month. We're going to talk a little bit about that later and how we can reach out to the community with that.
Sounds good.
We'll be right back.
1450 WOL.
Traffic report is brought to you by Garmin Network. In North Bethesda, jammed on 270 southbound between Old Georgetown Road and 495 Beltway in Bethesda. In Arlington, jammed on GW Memorial Parkway, southbound between Virginia 123 and Roosevelt Bridge. In Woodbridge, road construction in place, right lane closed on 95 Virginia southbound between 123 and 294 Prince William Parkway. Don't hate traffic, avoid it. Get the Garmin Nuvi with subscription-free HD digital traffic and keep moving. Drive with Garmin, the most trusted name in GPS. Weather brought to you by AAA.com. It's currently in the upper 30s under overcast skies and rain in the forecast. Overnight lows 33 and partly cloudy tonight. Don't get stranded. Get AAA's 24-hour roadside assistance. Save up to $73 on membership at AAA.com/promo. Liam Ferguson, News Talk 1450 WO, where information is power.
1450 WOL.
This is Montgomery Mosaic with Deborah Milo. I'm talking today with Heather Ross of the Montgomery County Department of Health and Human Services African American Health Program. And we started talking about, before the break, about how February is Heart Health Month. Heather, tell us, how do you reach out to the black community to educate individuals about heart disease and staying healthy? Now, you and I both know that we have people within our individual families who really are impacted by heart disease especially. And talking to them sometimes about staying healthy, no matter how smart or wise they may be, can really be a challenge. Can you talk a little bit about how some of the outreach works to the black community?
Actually, a large piece of our outreach with our community health workers, these are lay people who are from the community. These are individuals who we have trained, who are educated every month on different topics, but they work in the community one-on-one in where they live, where they work, where they go to prayer service,
right,
all that. We work with them and they work with us. So they're the connection to the community. And the one thing that they do a lot of is blood pressure screenings. They they have been trained, as well as they do an annual retraining, and these individuals actually do blood pressure screenings in the community. They meet with the people, and then they, if anyone needs to, they are referred to appropriate services. Some individuals who are seen with a very high blood pressure at the time actually have times been referred directly to the hospital because you don't know where they're at that point. We also are finding that with that, one of the things that we are looking at is some of our information and our data that we've received from these blood pressure screenings. Many individuals say, I've never been told about high blood pressure. I've never been diagnosed with high blood pressure.
Wow.
And then when we take their blood pressure screenings and we do their blood pressure, we're like, you're very much pre-hypertensive. Or has anyone ever told you you're having high blood pressure? We've even had individuals where we say, let's come back in 10 minutes, let's take it again, just to make sure. And they still are at that hypertensive range. And these are individuals who were never told they have high blood pressure. So that's one thing we do in the community, because we're finding that, in the United States, over 40% of those who are hypertensive are African American. And we really need to target and focus on that issue, because not only with high blood pressure, but it is a correlation with obesity, diabetes, and other risk factors as well. So we really are trying to stress to people, get your blood pressure, get your numbers, know your numbers,
right, because
knowing your numbers allows you to take control of your health as well. But our health educators really do a lot with the blood pressure screenings. We also, this year is actually our second year. This year, is our second. How do I say this? This year we're doing our Heart Health event. We do a Heart Health event every year. It's been, I think, 7 years, and we've worked with Holy Cross. And this year, though, we actually are doing 2 events in February. So we are actually targeting 2 communities. So it's not just going to one place and inviting people to our Heart Health event, which is basically a series of where you can get screenings done. You can talk to the doctor. It's also, there's some seminars going on, but we're doing it in 2 different communities this year, so that works really well. Great. And that's some things we're really trying to target and do for February. But we do that all year long too. So.
If you've just tuned in, welcome to Montgomery Mosaic. It's Deborah Milo chatting with Heather Ross from the African American Health Program with Montgomery County's Department of Health and Human Services. Okay, Heather, you know, we always talk about the really nice topical things that all of the community members know, but you know, there's something I really want to tackle, and I want to be able to really tackle it with some relish. And let's talk about some of the strategies that are used to reach the immigrant communities and ultimately gain their trust, because you and I both know, again, it's one of those, let's not talk about a topic, let's talk around it. There is an issue here when it comes to the African and the African American community, when it comes to health concerns. Yeah. Can you talk a little bit about some of the strategies that you're using to reach that population?
Well, with the African immigrant community, as I said, our community health workers are in the community. We actually have pretty much 60% of our community health workers are from the African immigrant community. So they are able to really reach and work with their specific community, which is excellent. As I mentioned before, we have our Diabetes African Dining Club, which is wonderful.
Right.
Another program we do, which was actually the idea from one of our staff and an intern, was how to reach those individuals who are French-speaking Africans.
Okay.
And many of them are what we call day laborers.
Right.
So they take jobs here and there, but they all meet at one location. And we were able to develop a program, and we call it the Project Santé Poto, which is Health for All.
Right.
I probably totally messed that up, my French. And I took French in high school.
Don't feel bad.
But it focuses on the French-speaking African day laborers, and we do bi-weekly education sessions at where they are.
Right.
And we do blood pressure screenings, but we also educate them every topic, every time we come on a different topic. Now, there's times we may see the same people, but there's times we see new people on a regular. So everyone is getting a new message all the time, which is good. And again, we went to where they are. We didn't wait for them to come to us. It's funny because a lot of people ask, oh, where's your location? Where are you located? And we have offices, but staff are not in those offices because they're always out in the community.
So you're touching people. You're actually out there. You're talking to them face to face. You're touching their lives.
Yes, we are. And again, not just through our staff, but through our community health workers, and some people call them health promoters because that's what they're doing. They're promoting health in the community, and that's been a big part of what we do.
Do you find that heart disease, since it is very prevalent within the black community, is it equally as prevalent within the African community?
Yes.
Okay.
Yes, it really is. We're finding that no matter what, if you are African American or African or Caribbean or African descent, we are finding that heart disease, just like obesity, just like many cancer incidents, are very prevalent in the community together. And that's why we're really working to form those relationships a lot better and bring people together.
While it seems that the health problems of African immigrants, they're not much different than those born in this country, and we know that.
Not much different at all.
Right.
At all. There are some differences when we talk about access to health care.
Right.
But when we're talking about these health issues, there is no difference. Really, there's none. And that's something that we're really trying to, as well, bring up as well, and bring that issue up and bring it out, because we want to all work together, because health disparities is killing many of us young.
That's right.
Very young.
That's right.
And when we say that, people kind of gasp to say, oh, 50. You know, we have individuals dying at 50 and 40 and 35 from heart disease, stroke. And again, for me, it comes personally. I lost my father before 50 with heart disease, with a massive heart attack.
Can you talk a little bit about I know we've talked about the community health events that you host. I wanted to chat a little bit about the mobile med clinics. I've heard so many wonderful things about that. Can you talk a little bit about that?
Well, we don't, our clinics, we don't really have clinics. The mobile med clinic is actually through a different program, but we work with them to do health education. So we are educating the community when they come to see them at that point. But we do a lot of health education and resources and pieces like that with a lot of groups in the county, including the mobile med clinic.
Okay. You were mentioning earlier about you had your 7th annual heart health screening and education event in partnership with Holy Cross.
Yes.
That was absolutely fabulous. Talk a little bit more about how the event has grown in popularity and attendance over the years.
Well, we have, like I said, this year we've built into two programs, and the second one will be February 22nd, which will be with Washington Adventist Hospital, and we're focusing in the Tacoma Park area. So we're going to, again, the community where they are. We've grown our event. It's been great that we've been able to grow with Holy Cross, but now we're actually growing in the community. So that's been a really big plus.
Beautiful.
Now, I do want to say that because our Holy Cross event was this weekend, but it was canceled because of the weather.
Snow, right?
Yes.
But they didn't call this Snowmageddon. This was Snowmageddon Junior.
Let me tell you, it's been difficult, but it's going to be rescheduled. So it probably will not occur in February, but it will go on because, again, heart disease shouldn't have just 1 month.
No, it shouldn't.
No.
We've talked about that before when we talked about Black History Month. It should not have 1 month or
and I was going to say that
days.
too.
Right,
yes.
right. There was some interesting dialogue that we've had about that in a public forum that I attended recently, and we talked about that very thing, so I can understand that.
Yes.
Has a date yet been set for the new date? Has it been set yet?
Not yet, no.
Okay,
no, we had to wait till the final hour to cancel because we didn't want to.
Yes.
But, the weather challenge. The weather, there's challenges, and then the cleanup. That's the thing.
Yes, I do understand that. If someone is listening today and wants to make an appointment for a health screening, or they just want to get more information about the program, is there a number or a website, a number they should call or a website they should visit?
Yes. Our website has a lot of great information. Our website is www.onehealthylife, and one is spelled out, O-N-E, healthylife.org.
Okay.
That is our website. It has all the information about all of our classes, all of our upcoming events. And if you have questions, if you want us to come to your church, if you want us to come to your organization, want us to come to your community event, and if you want to know where in the community we'll be doing screenings, call
240-777-1833.
Yes, that's our phone number. But definitely look us up on the website.
Okay, onehealthylife.org, 240-777-1833. Heather, this has been a fantastic and informative show, and I really appreciate you coming in.
Oh, I love it. Please, definitely welcome. I'm more than willing to come back. I'm more comfortable today.
Thank you, and join us again next month at the same time for another enlightening show on 1450 WOL, WPRS HD2, and worldwide on WOLDCnews.com. Until next time, stay inspired, stay healthy.
You've been listening to Montgomery Mosaic, featuring topics of interest to Montgomery County residents, businesses, and visitors. For more information or a copy of the show, email public information at montgomerycountymd.gov or call 240-777-6507. Be sure to tune in at this time every month on the third Wednesday for Montgomery Mosaic on 1450 WOL, WPRS HD2, and worldwide at WOLDCnews.com.